Hey everyone, it's Michael here at Home Health Success Academy, and in this video, we're going to be talking about the sales mindset. Remember, this is the beginning phases of you as a potential marketer for a home health agency, a home care company, or a hospice, or even a medical company, a medical supply company, for example. So, what we want to be able to do is before everything else, right? Let's say, for example, you already are in the industry and you already are a marketer. There are certain things, there are certain mindsets that we actually need to be able to put in place, right? A lot of times is people have this mindset about selling, right? And a lot of companies actually in our industry are trying to stop using the word sales, right? We don't want to tell people that we are selling home health services, home care services. But really, the truth is, we are selling these services, okay? We are trying to convince people to start using that. And what we want to be able to do is to be able to shift your mindset on a lot of different things. So, what are your current experiences regarding sales? Okay, so are you typically, when you think about selling, when you think about sales, for example, are you thinking about those dirty car salesmen that are pushy, that are shoving, that are trying to pressurize you to be able to buy a car or an SUV? Right? What is your thinking about selling? We need to be able to shift your mindset on selling first. And the reason for that is because if we cannot convince you on the mindset of what you're doing, that can also translate on how you present your product and your services to a potential client, a potential referral source, or even to a potential um, daughter or son who wants to be able to find services for their mom or dad or grandpa or grandma. Okay, so what we need to understand is that when we're selling our product and services, we're not really selling our products at first. We need to be able to first think about it this way. Imagine this, right? I want you to imagine, let's say, for example, a friend of yours gives you a call and starts talking about this amazing restaurant they went to, how the dessert was amazing, the service was amazing, the ambiance was amazing, right? You get this call from your friend, they're sharing this information with you. And as they're sharing these information, you start thinking, like, oh my God, I want to go to this restaurant. I want to experience the same thing that you experienced. Where is it located? When did you go? Who serviced you? What was the occasion? All these different things, right? So what your friend is doing is, are they sharing information with you, or are they actually selling the service? Well, they are actually selling it to you. So selling and sharing is pretty much synonymous in everything, and we need to be able to shift your mindset of thinking about that stuff, and because the last thing you want to do is second guess yourself. Because when you start second guessing yourself and you start thinking, am I pressurizing somebody? Am I pressuring them to start using our services? And there is some, maybe you can say form of pressuring a little bit because we want to be able to get the sale. But if you start having the thinking that I'm pressuring people, that can actually, back off on you a little bit. Have you ever worked with a salesperson? They're trying to sell you a product and you're not fully convinced about it, and you start hearing them pressuring you, pushing, pulling you to be able to start using the product and services. Buy now, use this now, you should try this now, get this, it's not going to last too long. Well, in our industry, it's a long process, it's a long sales process to be able to start getting somebody to start referring to you. Rarely do we see a referral source start referring a patient to you automatically, right? Not in the first try. So, what our goal here is to first make sure and give you an idea that you need to be able to share information. And first, you need to shift your paradigm thinking of that it is not being pressure, you're not trying to be pulling people, you're not trying to grab them, start referring patients to you. But what you want to do is you want to be able to think in yourself that you're not really pressuring people, you're not really selling people, you're actually sharing information. You must be able to share information about why they need to start using your services. So before we even start about creating a sales process for your agency, before we start telling you how to be able to present your product, present your services, we need to be able to shift your mindset about selling. Okay. Another thing is a lot of agencies are started off, let's say, a mom and pop organization. Um, that you have a bunch of medical people, medical background. They're nurses. They've been in the industry. They're therapists, and then they want to start a home health agency. But they forgot the whole part that they still have to sell their product. Okay, So you as a salesperson, you as a marketer, you as a community liaison, you as an account director. There's all these different names that we use for people that tries to sell home health services. But in the end, you are a salesperson, okay? But we typically start having a lot of different terms. The reason why we're creating so many terms about your position instead of calling you a home care sales representative is because a lot of people have a negative connotation when it comes to sales. But in the end, you are selling the product and services. But we need to make sure that if you're selling the products and services, that you don't have any negative thinking about it. So understand that you're not really selling, you're sharing information. And if you have a good product, if you really have a good product and you believe in the product, then it'll be easier for you. I've dealt with a lot of salespeople, a lot of sales teams. I've even dealt with a lot of owners and administrators, and I've asked them, would you trust your mom, your dad, your grandma, your grandpa to your own employees, right? And they would say yes. Then I would ask the same question, every one of your employee, would you trust them? And then they'll come up with the answer like, well, maybe not this one nurse, or maybe not this one therapist, or maybe not this one doctor, okay? And so that is where it comes about. First things first is you must have a good product, okay? Because if you're a salesperson, if you're somebody that's going to market this product, you must believe in the product, okay? But before we even get to that, we must be able to first create the sales mindset and understand that selling is not a negative thing. It's a good thing, because if you have a great product, you have a great service, then what you're doing is, yes, there is going to be a feedback. There's going to be a counter to you. You guys are going to get paid. You're going to get paid as an employee. The company's going to get paid. That is understandable for that, right? But at the same time, it's because they decided to use your services, your company, your product. At the same time as the referral sources, patients are going to get a good service. They are going to get great nurses. They are going to get great caregivers, great homemakers. So, like I said, let's remove the negative thinking about what sales is, what we're doing here, and at the same time, let's look at the fact that we're sharing some information so that they can use the right company.